Drug Administration have unanimously endorsed making a birth control pill available without a prescription. Experts say consumers could use the oral contraceptive called Opill safely without a physician's oversight. This also would increase access to contraceptives. The FDA is expected to make a final decision on Opill later this year. Meanwhile, the battle over the abortion pill mifepristone will take center stage again next Wednesday at a hearing before the Fifth U.S. Circuit Court of Appeals in New Orleans, made up of 3 conservative judges. The case is being brought by groups seeking to ban the pill nationwide. The Biden administration is expected to urge the court to overturn a previous court order that suspended the federal government's approval of that drug. Joining us now is the president of the American Medical Association, Dr. Jack Resnick, Jr. He's also a physician at the University of California at San Francisco. Doctor, it's good to have you with us this morning. Let's talk about mifepristone first. We've got a lot of ground to cover with you here. What is the fate as you watch it as a physician? First of all, how important it is to what doctors do and to women who use it, but also as you look at the courts, where do you think this ends?
I was really relieved that the New York Times actually gave us the opportunity to publish this op-ed, because I think I just can't sugarcoat how dangerous a time this is in medicine for this level of government interference that we're seeing. And physicians across the country are deeply worried about this. And this case is really important on 2 fronts. First of all, you have this drug, mifepristone, which is tremendously important for women. It's the major thing that's used for medication abortions. It's also the primary drug that is used for miscarriage management when somebody gets an infection or bleeding or other complications that require assistance with treating a miscarriage. So just keeping that drug on the market and not having it taken off, incredibly important for women's health and the health of the nation. But the other thing that I wrote about in that editorial was that this is scary for our entire drug approval system overall. We're facing a risk that if any part of this Texas decision made by a judge with no experience in medicine or science goes forward, we fear a whole nother train of these lawsuits on other medications that could be taken off the market just because some ideological judge inserts their opinion on contraception or HIV drugs or cancer drugs or anything else. Make it a really hard time to practice medicine in this country.
There are still people who object to the use of stem cells in research.
That's right.
They go after anything that uses that kind of research. There are people who object to mental health drugs. They could try to take those off the market. So what is your concern broadly about all of that? Not just mifepristone, but are you worried that some of this actually is going to happen given where we are right now?
Really relieved by what the Supreme Court did at this point to step in. Obviously, we have to watch what happens in the Fifth Circuit starting next week. We at the AMA have briefed at every level in this case because it is of such core importance to our drug approval system that's been around for 85 years in this country and has worked really well.
You're also writing and talking, Doctor, about what's changed in the last, 11 months or so since Roe versus Wade was overturned for physicians and the criminalizing of procedures that doctors have done for generations now, kind of looking over their shoulder and thinking about, am I going to go to jail for helping this woman who has come to me with a complication in her pregnancy or something like that? Can you kind of lay that out? Because I don't think people talk they don't hear it from your point of view about what's actually happening in those rooms.
This is unprecedented, the level of government interference and the decision making that happens with doctors and patients sitting down in exam rooms together like we do every day. It's a part of the work of frontline physicians that happens all the time. And exactly as you said, physicians are now imagining state legislators, state attorneys general, others sitting on their shoulder in those exam rooms. It's getting pretty darn crowded in those exam rooms with all these people second guessing. And it's important for multiple reasons. So there are the medical indications for abortion, like when somebody has an ectopic pregnancy, that's not even really an abortion, to treat that, or when somebody has a complicated miscarriage. And so we are seeing situations where physicians and emergency departments and clinics around the country are literally having to call hospital attorneys when somebody who's sick and unstable presents right in front of them to say, do you think I can treat this person? Is a 30% chance of death enough to step in here? And sometimes literally attorneys saying, no, you got to wait till that person has a 50% chance of death because these laws are so vague. The second thing that we're seeing is we're really beginning to see downstream consequences in these restrictive states across the country. Heartbreaking stories that I'm hearing from places like Idaho with some of the most restrictive laws in the country, where OBGYNs who've practiced in these communities for years are making difficult decisions about, do I abandon this community because I'm too afraid to practice medicine here because I think I could go to jail? We're seeing medical students across the country now not applying to residency programs. So these restrictive states are going to have fewer physicians because people are afraid to train in those states.
Yeah, let's talk about that exact thing a little bit more here with this increased scrutiny, the legal pressure, also for so many in the medical profession still grappling with burnout from the pandemic. What are you seeing? Are people leaving the red states, but also leaving the profession writ large?
Well, this is one of the things that keeps me up at night as AMA president. I really do worry about our workforce. We have seen burnout numbers in our physician workforce at the beginning of the pandemic, like 30% was already too high, going well into the 60s. We're seeing 1 in 5 physicians in this country saying that they're likely to retire or do something else entirely in the next 2 years. And I know your viewers are already experiencing wait times that are too long to get in to see a physician, whether it's a primary care doctor or a specialist. So it is not a time when we want, at the back end of that workforce pipeline, to have people leaving. And we know that this level of government interference is one of the things that is getting people down. On top of all the administrative burdens that are building up, things like prior authorization, where health insurance plans make it difficult for patients to get the drugs they need, and physicians have to send one fax after the next to get things approved. We've seen Medicare pay cuts across the board for physicians this January. So the number of things I think that are pushing that workforce out are growing.
Dr. Susan Page has a question for you. Susan?
Dr. Resnick, when you think about the history of federal regulation of drugs in the United States, has there been a previous time when political considerations, the political debate has loomed so large in what the FDA can do and what the federal government can do on drugs? Has that happened before?
It's a great question, and I have seen no precedent for anything like this, where we literally have the threat of an individual judge in a district in Texas saying, hey, I'm going to overlook all the science that the FDA looked at for a drug that was approved 23 years ago and just take it off the market. I've never seen anything like it.
Dr. Resnick, the piece in the New York Times op-ed is out now, and it's jarring. It's eye-opening. So people should go and take a look at it. President of the American Medical Association, Dr. Jack Resnick, Jr., thanks so much. We appreciate you being here.
Thanks for having me.